So there are many challenges during the care of MS patients during this weird time. So many of our patients belong to a risk group, really depending on the treatment most of all. MS per se does not qualify as a risk group, but really it depends on the treatment. And especially in Switzerland, we had an issue with mobility. Really, how can the patients come to the centers, because they were advised not to take the public transport. So that was really an issue. One thing that helped us a lot was really everything around digital, virtual, telephone conferences, video conferences, things like that. However, that also poses an issue because the patients appeared to like it. So we really need to make sure that they come back, because eventually a doctor needs to see his or her patient. And the second thing is really, it's very important not to lose the patients, especially with the MS medications. When the patients are stable and they, left out one or two visits, then the likelihood that they leave out the next visits is high. And, for safety reasons and also for redosing issues. And so we would, of course, love to see our patients eventually. So these were the different challenges, really. So I believe the challenges with the treatment, with the disease-modifying treatment of MS are, again, also manifold. So first of all, it's a very local issue, depending on the pandemic situation and the viral situation in your country or even in your region. You may have just an entirely different approach. Secondly, what makes it difficult is in neuroimmunology, we love to think about mechanisms, pathomechanisms, immunology, and then, we love to somehow do a translational step and then translate that into perfect medication. This is really difficult in here because we just don't know what the pathomechanisms in detail are around that virus, also the temporal order of these different mechanisms. And therefore, the interplay between the mechanisms of action of our immunomodulatory treatments or immunosuppressive treatments and the viral pathogenesis, these are very difficult to reconcile and to foresee. So, we had said in the initial recommendations, probably agents like interferons, type 1 interferons, interferon beta should not be difficult and maybe even protective, antiviral. There's a New Lancet paper which indicates something like that. That's an easy guess. But how about other more, active agents? So that we are asking ourselves, how about depleting agents? But then again, also other antibodies, for example, anti-IL-6 antibodies are also in clinical studies with this COVID-19 pandemic against the cytokine storm. So it's very difficult to have a clear picture right now. And also, in the end, really, we need clear data, and we are only starting to gather these data. So for me personally, the most exciting novelty is in the treatment not of MS per se, but rather neuromyelitis optica, I have to say. So, given that this is a really devastating disease, or can be a devastating disease, all the new approved medications for NMO are really a major step forward, I have to say. For disease-modifying treatment of MS itself, it's really, meanwhile, the robustness of the treatment armamentarium that we are having, the chance to select agents according to disease phenotype, to disease activity, but also according to patients' preferences and other individual aspects, this is really the major progress that we're having right now. The major unmet need for me still is really we're lacking good markers how to individualize these plenty substances. Content-wise, during this Congress, of course, I found the COVID-19 session highly interesting. Also because, you know, you had the spirit of something like European neurology. I mean, this is, in the end, what the society is about. We need to stand together, and we want to do things together. And then the other highlight was really that it's possible to do a meeting entirely digitally. It was fun. Sometimes it was challenging, like technically. But you know, it's amazing to see colleagues that you know very well back home in their rooms, to see what kind of wallpaper they have, pictures on the wall. I love that a lot. I enjoy that a lot.